There is a kind of fear that lives quietly in the back of the human mind, a fear so ancient and so deeply rooted that we rarely speak about it, yet it lingers in the silence of late nights and in the brief moments when something feels slightly off inside our bodies, a feeling that something invisible may already be moving, already unfolding, already beyond control, and that is the kind of fear that surrounds rabies, a disease whose very name carries a weight that feels cold and unsettling, because it does not arrive loudly. It does not announce itself with certainty. It simply exists in the shadows of everyday life, hidden in small encounters we forget, in moments we dismiss, in memories that fade too quickly. And long before anyone realizes what is happening, a quiet sense of dread can begin to take hold, not just in the body, but in the mind, in the way a person starts questioning every sensation, every thought, every strange feeling that wasn't there before, wondering if something has already started that cannot be stopped, because rabies is not just a disease people hear about. It is a story that has followed humanity for centuries, a story whispered in villages, cities, and homes, a story that carries an almost haunting presence, because once it becomes part of someone's life, it changes everything, not only for them, but for everyone around them. And that is what makes it so terrifying, the idea that something so serious could exist so close to ordinary life, so near to places where people feel safe, and so silent that it doesn't create panic at first, only a slow, creeping unease that grows stronger with time, the kind of unease that makes a person pause and think, what if? What if something already happened? What if something I didn't notice mattered more than I realized? What if the danger was already there before I even knew it? And this is where the real fear begins, not in the moment itself, but in the uncertainty, in the waiting, in the not knowing. Because the mind starts to imagine the worst, starts to question every past moment, every forgotten memory, every brief encounter that once seemed meaningless. And suddenly those small moments don't feel small anymore. They feel heavy, important, and frightening. And the thought that something so serious could begin without warning, without pain, without immediate signs, creates a kind of emotional weight that is hard to ignore. Because deep down, people understand that rabies is not just another illness. It is something people have always feared, something that has always carried a sense of finality, a sense of urgency, and a deep emotional intensity that makes even the strongest person feel vulnerable, because it reminds us that life can change in ways we never expect, and that sometimes the most dangerous things are the ones we never see coming, the ones we never prepare for, the ones that quietly step into our lives without asking for permission. And as this thought settles in, it creates a powerful sense of curiosity and concern, a feeling that makes a person want to know more, to understand more, to be sure, because once the idea enters the mind, it does not leave easily. It stays there, asking questions, creating tension, and pushing a person to keep listening, to keep watching, to keep searching for answers, hoping that what they fear is not real, but unable to ignore the possibility that it might be. When we talk about rabies, the first thing I want you to understand is what this disease truly is, because understanding it clearly removes confusion and gives you power. Rabies is a viral infection, which means it is caused by a virus, a microscopic organism so small you cannot see it, yet powerful enough to affect the human nervous system in a very serious way. Unlike many common infections that stay in one part of the body, rabies has a very specific and frightening target. It attacks the brain and the nerves. Think of your nervous system as the body's electrical wiring, carrying messages from your brain to your muscles, your heart, your lungs, and back again. Rabies interferes with this system. It slowly travels through the nerves toward the brain, and once it reaches there, it begins to disrupt the way the brain functions. That is why rabies is considered one of the most dangerous viral diseases known to humanity. It is not just a fever or a temporary illness. It is a condition that directly affects the control center of your body. This virus is usually transmitted through the saliva of an infected animal, most commonly through a bite, and once it enters the body, it does not immediately cause dramatic signs. Instead, it can stay quiet for a period of time, moving silently through nerve pathways. This silent phase is what makes rabies especially dangerous, because a person may feel completely normal at first and not realize that anything serious has begun. Over time, as the virus reaches the brain, it causes inflammation, which means swelling and irritation of brain tissue. This inflammation affects thinking, behavior, movement, and basic body functions. That is why rabies is classified as a neurological disease, meaning it impacts the nervous system. One of the most important things to understand, and I say this with seriousness and care, is that once rabies reaches an advanced stage and clear symptoms appear, it becomes extremely difficult to reverse. This is why medical professionals treat rabies exposure as a medical emergency, even before symptoms start. The disease has been known for thousands of years, and despite all our medical advances, it remains one of the deadliest infections once it progresses. However, and this is very important, rabies is preventable if addressed early. That is the key message I want you to hold on to. Rabies is not something that randomly appears without reason. It follows a clear path of transmission, and when we understand that path, we can interrupt it. So when we define rabies, we are talking about a viral infection that targets the nervous system, spreads through infected saliva, primarily from animal bites, and can become life-threatening if not treated promptly. Knowing what it is helps remove myths and replaces fear with awareness, and awareness truly is the first step toward protection. As we continue, I want you to stay with me, because the more you understand about this disease, the more confident and prepared you will feel. When we gently talk about what causes this disease, I want you to think of it as something that begins from a very specific moment, a moment that often feels small and forgettable, but can carry serious consequences if not taken seriously. This disease is caused by a virus that lives in the saliva of infected animals, and the most common way it enters the human body is through a bite that breaks the skin. It can also enter through scratches, or if infected saliva touches an open wound or sensitive areas like the eyes or mouth. Many people think it only happens from wild animals, but in reality, it can come from animals we see around us every day. Dogs are responsible for most human cases in many parts of the world, especially where vaccination of animals is not consistent. Cats, bats, monkeys, and other mammals can also carry the virus. The important thing to understand is that the virus does not come from the animal's fur or from simply being near an animal. It needs a path into the body, and that usually happens when the skin is broken. Sometimes people ignore a small bite or scratch because it does not hurt much, or it seems too minor to worry about. A child might be playing outside, an adult might be feeding a stray animal, or someone might try to help an injured animal without protection. In these moments, the virus can quietly pass from the animal's saliva into the body. Once it enters, it does not spread through the blood like many other infections. Instead, it slowly travels along the nerves, moving step by step toward the brain. This journey can take time, which is why people may not connect the cause with what happens later. That delay can create a false sense of safety, making someone believe nothing serious happened. Another important cause is contact with animals that appear normal at first. An infected animal does not always look sick in the beginning. It might still move around, eat, or behave in ways that seem ordinary, which makes it harder for people to realize the risk. In some cases, bats can be a hidden source, especially because their bites can be so small that a person may not even notice them. This is why awareness is so important. It is not about living in fear of animals, but about understanding that certain types of contact can carry risk. The virus cannot survive long outside a living body, so it is not spread through air, water, or casual touch. It needs that direct pathway into the body to begin its journey. This means that most cases happen because of close, unprotected interaction with an infected animal. Many times, people only realize the importance of that moment later when they look back and remember a bite or scratch they once ignored. That is why every bite, no matter how small, should always be taken seriously. I say this not to alarm you, but to help you stay aware and protected. The cause is always connected to that first contact, that one moment when the virus is given a chance to enter. If you ever experience such a moment, do not stay silent or unsure. Reach out, seek advice, and take action early, because caring for yourself at the right time can make all the difference. When we begin to talk about symptoms, this is where the conversation becomes very serious, because the signs of this disease often start in a way that feels almost ordinary, and that is what makes them so easy to overlook. In the early stage, a person may simply feel unwell, as if they are coming down with the flu. There might be a mild fever, tiredness, headache, body aches, or a general sense that something is not right. Some people describe feeling anxious or unusually irritable without understanding why. There can also be a strange tingling, itching, or burning sensation around the area where the bite or scratch happened, even if that injury healed weeks or months ago. That unusual feeling at the old wound site is an important warning sign, because it can mean the virus is affecting the nearby nerves. As the infection moves forward and reaches the brain, the symptoms become much more intense and frightening. A person may develop confusion, agitation, or sudden changes in behavior. Someone who was calm may become restless or aggressive. There may be difficulty concentrating, trouble sleeping, or vivid dreams and hallucinations. One of the most well-known and distressing symptoms is difficulty swallowing. The muscles in the throat can begin to spasm painfully when trying to drink water, which can create a deep fear of drinking. It is not that the person does not want water. It is that the act of swallowing becomes extremely uncomfortable. This can lead to severe thirst, but an inability to drink, which is emotionally and physically distressing. Breathing can also feel irregular as the nervous system becomes more affected. In some cases, there may be excessive salivation because swallowing is difficult, which can make speech unclear. As the brain inflammation worsens, the person may experience muscle weakness, paralysis, or seizures. The body and mind begin to lose coordination with each other. There is another form of the disease that does not present with extreme agitation, but instead with gradual muscle weakness, starting near the bite area and slowly spreading. This form can look quieter on the outside, but is equally serious. What is most important to understand, and I want to say this clearly, is that once these advanced neurological symptoms appear, the condition becomes extremely dangerous. That is why doctors focus so strongly on acting before symptoms ever begin. The tragedy of this disease is that early signs can be mild and easy to dismiss, but later signs are severe and life-threatening. If anyone has had a possible exposure and then begins to feel unusual symptoms like unexplained fever, tingling near a past bite, confusion, or difficulty swallowing, that is not the time to wait or hope it passes. Immediate medical care is critical. Please do not ignore these warning signals. Your life and your health are too important. If you ever feel uncertain after an animal bite or scratch, speak to a healthcare professional right away. Acting early can save your life, and there is no shame in being cautious when it comes to something this serious. When we talk about prevention, I want you to feel a sense of control and reassurance, because this is one of the few serious diseases where the right actions at the right time can truly protect your life. Prevention begins with awareness in everyday situations, especially when it comes to animals. It does not mean you should fear animals or avoid them completely, but it does mean being careful and respectful of boundaries. Try not to approach stray dogs or cats, even if they look friendly, calm, or injured. Children, especially, should be gently taught not to touch unknown animals or play with them without an adult nearby. Many bites happen not because an animal is aggressive, but because it feels scared, threatened, or startled. A simple moment, like trying to feed or pet an unfamiliar animal, can sometimes lead to an unexpected bite or scratch. If you have pets at home, keeping them vaccinated and healthy is one of the strongest ways to protect not only them, but your entire family. A vaccinated pet acts as a shield between your household and this disease. Now, if a bite or scratch ever does happen, even if it feels small or looks harmless, the first and most important step is to clean the wound immediately. Wash the area thoroughly with soap and running water for several minutes. This simple action can help reduce the amount of virus that may have entered the skin. After washing, seeking medical care without delay is very important. A doctor can guide you on what steps to take next, and early care can stop the disease before it even has a chance to begin. Time truly matters here. Waiting, hoping, or ignoring the wound can allow the virus to move quietly inside the body. Many people make the mistake of thinking that if the bite does not hurt much, or if the skin looks fine after a few days, then everything must be safe. But prevention is not about how painful the bite feels. It is about acting early and staying protected. In places where animals roam freely, being mindful of your surroundings can make a big difference. Avoid handling animals that are acting strangely or seem unusually aggressive or sick. If you notice an animal behaving in a way that feels unsafe, keeping distance is the best choice. Community awareness also plays a role. When people understand the importance of vaccinating pets and reporting animal bites, it helps protect everyone. For those who work closely with animals, like veterinarians or animal handlers, special protective steps and vaccinations can provide extra safety. Prevention is really about small, thoughtful actions that create a strong layer of protection around you and the people you love. And I want to leave you with this gentle reminder: your safety is always worth the extra care. If you ever find yourself unsure after an animal bite or scratch, do not stay silent, do not wait, and do not assume it will be fine. Speak to a healthcare professional, get the right guidance, and take that step for your peace of mind. Your life matters, your health matters, and sometimes one careful decision at the right time can protect your future in ways you may never fully see. When we speak about treatment, this is where hope becomes very real, because unlike many people believe, there is a powerful and effective way to stop this disease if action is taken early enough. The most important thing to understand is that treatment works best before symptoms begin. Once clear neurological signs appear, the disease becomes extremely difficult to reverse, which is why doctors treat any possible exposure as an emergency. If someone is bitten or scratched by a potentially infected animal, the first step in treatment actually begins at home, immediately washing the wound thoroughly with soap and running water for several minutes. This simple act can significantly reduce the amount of virus in the area. After that, medical care should be sought without delay. In a healthcare setting, doctors assess the risk based on the type of animal, the severity of the bite, and the area of the body affected. If there is any possibility of infection, a series of injections called post-exposure prophylaxis is given. This treatment includes a vaccine that helps your immune system recognize and fight the virus before it can reach the brain. In some cases, an additional injection called Rabies immunoglobulin is given around the wound site. This provides immediate antibodies, which are protective proteins that start fighting the virus right away while your body builds its own defense through the vaccine. The vaccine is given over a schedule of several days, and it is extremely effective when started promptly. Many people worry that the injections are painful or unsafe, but modern vaccines are much safer and more comfortable than older versions. The discomfort is minimal compared to the protection they provide. The key message here is urgency. Treatment is not something to delay or wait and see. Even if the bite seems small, even if the animal looked healthy, even if you feel completely fine, starting treatment quickly can completely prevent the disease from developing. If symptoms have already started, treatment focuses on supportive care, helping the patient stay comfortable and managing complications. But at that stage, the situation is very serious. That is why prevention and early treatment go hand in hand. If someone works in a high-risk environment, such as veterinarians or animal handlers, preventive vaccination before exposure can also be given to provide an extra layer of safety. I want you to remember this clearly and calmly. This disease is almost always preventable with timely medical care. There is no reason to suffer in silence or feel embarrassed about seeking help after an animal bite. Doctors are trained to handle this situation with urgency and care. If you or someone you love ever faces a possible exposure, please act immediately, wash the wound, and go to the nearest healthcare facility. Do not let fear or hesitation delay you. Your life is precious, and taking quick action can mean the difference between danger and complete protection. If this information helps you feel more aware and prepared, share it with someone you care about, because one informed decision could save a life. As we come to the end of this conversation, I want you to take a slow breath with me and remember that knowledge is not meant to frighten you. It is meant to protect you. When we talk about a disease this serious, it is easy to feel anxious, to replay memories in your mind, or to imagine worst-case scenarios. But I want you to walk away from this feeling informed, not overwhelmed. The truth is, while this disease is extremely dangerous once it advances, it is also one of the most preventable infections when handled correctly and early. That balance is important. Fear alone does not save lives. Awareness does. Simple actions like being careful around unfamiliar animals, teaching children how to stay safe, vaccinating pets, washing a wound immediately, and seeking medical care without delay are not complicated steps. They are practical, manageable decisions that give you control, and control brings calmness. If you ever find yourself in a situation where you are unsure, I encourage you not to sit alone with that worry. Talk to a healthcare professional. Ask questions. There is no such thing as overreacting when it comes to your safety. As a doctor, I can tell you that we would always rather see someone come in early for reassurance than see someone wait too long out of fear or doubt. Your health matters too much to gamble with uncertainty. I also want you to remember that animals are not the enemy. Most animals are not infected, and most interactions are completely safe. This is about awareness, not panic. It is about respecting boundaries and understanding risk. When communities stay informed and responsible, when pet vaccinations are up to date, and when people respond quickly after a bite, lives are protected. That is the real message here. You are not powerless in this situation. You are capable of taking the right steps if needed. And if you have never experienced an animal bite, then let this information simply sit in your mind as quiet preparedness, something you hope never to use, but are grateful to know. If you have experienced one in the past and never sought advice, and you are feeling worried right now, please speak to a medical professional for guidance and peace of mind. Do not let silent anxiety grow inside you. Clarity is always better than fear. I hope this conversation has helped you understand not just the seriousness of this disease, but also the strength of early action. If this message brought you value, consider sharing it with someone you care about. Sometimes one piece of information, shared at the right time, can protect an entire family. Stay aware, stay calm, and most importantly, take care of yourself and the people you love.